My name is Abiram Kandaji, and I'll be talking to you today about why gastroparesis with concomitant gastrointestinal dysmotility is not a contraindication for per-oral pyloromytomy. To start, gastroparesis is a functional and symptomatic disorder of the stomach, causing an objective delay in gastric emptying in the absence of a mechanical obstruction. Patients who have already undergone lifestyle changes and pharmacotherapy and have failed to have symptom relief are often referred to a surgeon for more invasive procedures such as a gastric simulator, feeding tubes, or surgical pyloroplasty. The per-oral pyloromytomy, also known as POP or GPOM, is an emerging endoscopic treatment for gastroparesis where the pylorus muscle is divided through a submucosal tunnel in the distal stomach, as demonstrated in Figure 3. The objective is based on the fact that the POP has already demonstrated short-term subjective and objective improvements for gastroparesis. The SMART pill, as demonstrated in Figure 4, assesses gastric emptying and provides additional GI motility data. The question we ask is, do patients with isolated gastroparesis show a difference in outcomes compared to those who have gastroparesis plus coexisting dysmotilities of the small and large bowel? We did a retrospective chart review of patients who had per-oral pyloromytomy and also completed a SMART pill test during the dysmotility assessment. Objectively, he looked at the gastric emptying study, also known as GES, and the subjective measure was the Gastroparesis Cardinal Symptom Index, labeled as GCSI. Patients were then divided into the gastroparesis and the gastroparesis plus dysmotility group based on the SMART pill data. Figure 1 demonstrates the pre and post gastric emptying studies for the patients who've had the POP procedure. And there is no difference between the two groups in terms of outcomes. However, both groups did demonstrate an overall improvement. Figure 2 looks at the effects on the GCSI, which is a subjective measure. Both groups showed a subjective measure in their scores. However, there was no difference between the two groups. In conclusion, our study demonstrated that patients who have gastroparesis, as well as those with gastroparesis and additional dysmotilities, showed an improvement in gastric emptying study times, as well as their subjective measures of the Cardinal Symptoms Index. Comorbidities such as elevated BMI, smoking, prior surgeries had no impact on the outcomes, and there was no statistical difference between the two groups. The takeaway is that the SMART pill reveals coexisting dysmotility in gastroparesis patients that is not readily evaluated by the gastric emptying study. In conclusion, POP palliates gastroparesis symptoms and improves gastric emptying while still allowing additional interventions if the patient has ongoing symptoms. Thank you for your time.